What if I told you that one of the biggest reasons many adults lose mobility and independence after the age of 60 is not disease, but the gradual loss of a few basic movements that the body simply stops practicing? These movements are not extreme workouts. They are not complicated gym routines, and they do not require expensive equipment. They are simple actions your body was designed to do every single day. Standing up from a chair, balancing on one leg, stabilizing yourself when you shift your weight, keeping your ankles strong enough to react if you stumble. But here is the problem. As we age, the muscles, the nerves, and the balance systems responsible for these movements slowly become less active. Research shows that after age 60, muscle strength and balance control can decline significantly if they are not specifically trained. And when those systems weaken, everyday activities like climbing stairs, getting out of a chair, or catching yourself during a small misstep become much harder. This is one of the reasons falls remain a leading cause of injury and loss of independence in older adults. The encouraging news is that the body is far more adaptable than most people realize. Studies in geriatric exercise science show that targeted strength and balance exercises can significantly improve stability, mobility, and confidence in movement, often within just a few weeks of consistent practice. And the most effective exercises are surprisingly simple. In this video, we will walk through 4 research-supported exercises that help strengthen the muscles and balance systems that protect mobility after 60. Each one targets a key area that commonly weakens with age and plays a direct role in staying steady, strong, and independent. Before we begin, tell us in the comments your age and where you are watching from. We enjoy reading them and hearing from viewers around the world. Now let us start with the first exercise. Number 1. Standing heel raises. For ankle strength, standing heel raises are one of the most overlooked, yet highly effective exercises for maintaining stability and mobility after the age of 60. While many people focus on larger muscles, like the thighs or the hips, the muscles around the ankles and the calves play a very important role in balance, in walking efficiency, and in preventing falls. Research in geriatric rehabilitation shows that weakened ankle muscles are strongly associated with instability and slower reaction times when recovering from a stumble. What makes heel raises especially important is that the ankles are often the body's first line of defense when balance is challenged. When you begin to lose balance, small adjustments at the ankle joint help shift your weight and stabilize the body before larger movements are required. Studies in journals such as Clinical Biomechanics and Gait and Posture have found that strengthening the calf muscles improves walking stability and helps older adults respond more effectively when their balance is disrupted. To perform standing heel raises, begin by standing behind a sturdy chair, a countertop, or a table that you can hold lightly for support. Position your feet about hip-width apart. Stand tall, with your shoulders relaxed. Keep your weight evenly distributed across both feet. Engage your core slightly to maintain good posture. Slowly lift your heels off the floor by pressing through the balls of your feet. Rise as high as is comfortable while keeping your body upright. Take about 2 seconds to lift up. Pause briefly at the top of the movement. After the pause, slowly lower your heels back to the floor. Over 3 seconds. This controlled lowering phase strengthens the muscles and tendons that help stabilize the ankle joint. Begin with 8 to 10 repetitions. Gradually work up to 15 or even 20 as your strength improves. If the movement becomes easier, you can increase the challenge by holding the raised position for a few seconds before lowering, or by performing the exercise with one foot slightly lifted. So most of the work is done by the standing leg. Beyond strengthening the calves, heel raises also improve circulation in the lower legs and support better walking mechanics. Stronger ankles help your body make quick balance corrections when stepping on uneven surfaces or when changing direction. Over time, this increased stability can make everyday activities like walking, climbing stairs, and standing for longer periods feel easier and more secure. Number 2. Single leg balance. Near a support, single leg balance exercises address one of the most significant physical changes that occurs with aging, the gradual decline of balance control. After the age of 60, the systems responsible for maintaining balance, including the inner ear, vision, muscles, and the nervous system, begin to lose efficiency. Research consistently shows that poor balance is one of the strongest predictors of falls. In older adults, even individuals who walk regularly can experience declining balance if it is not specifically trained. What makes single-leg balance training so powerful is that it challenges the body's stabilizing systems in a very direct way. When you stand on one leg, small muscles in the feet, ankles, hips, and the core must work together to keep the body upright at the same time. The brain continuously processes sensory information to adjust posture and maintain stability. Studies published in journals like Age and Aging show that practicing balance exercises regularly can significantly reduce fall risk and improve reaction time when balance is disrupted. To perform single-leg balance safely, stand next to a sturdy support, such as a countertop, a table, or the back of a chair. Place 1 or 2 fingers lightly on the support. If needed for safety, stand tall, with your feet hip-width apart. Keep your shoulders relaxed. Engage your core slightly by gently tightening your abdominal muscles, just enough to support your posture. Slowly lift one foot a few inches off the ground. Keep your standing leg slightly bent. Focus your gaze on a fixed point in front of you. This helps the body maintain balance. Try to hold this position for 10 to 15 seconds while breathing normally and keeping your posture upright. Lower your foot back down slowly with control. Then switch to the other leg. Start with 3 or 4 holds per leg. Gradually build up to 20 or even 30 seconds as your balance improves. If the exercise becomes easier, you can challenge yourself by reducing the amount of hand support or performing the exercise with your arms crossed over your chest. Balance training does more than strengthen muscles. It also improves communication between the brain and the body. When your body practices maintaining stability in a controlled setting, it becomes better prepared to react quickly if you trip or step on an uneven surface. Over time, this improved coordination can make walking feel more confident and reduce the likelihood of dangerous falls. Number 3. Sit to stand with controlled descent. Sit to stand with controlled descent is one of the most important functional strength exercises for adults over 60 because it directly trains the muscles responsible for one of the most common movements in daily life, standing up from a seated position. Research in geriatric exercise science consistently shows that lower body strength, particularly in the quadriceps and the glutes, is one of the strongest predictors of independence in older adults. When these muscles weaken, simple actions like getting up from a chair, using the toilet, or standing after sitting become increasingly difficult. What makes the sit-to-stand exercise especially valuable is that it mirrors a real-life movement pattern. Unlike isolated gym exercises, this movement trains multiple muscle groups together while also engaging balance and coordination. Adding a slow, controlled descent back into the chair increases time under tension and strengthens the muscles responsible for stabilizing the knees and the hips. Studies in journals, such as the Journal of Aging and Physical Activity, have shown that controlled eccentric movements, which means the lowering phase of an exercise, play a crucial role in maintaining muscle function and joint stability. In older adults, to perform this exercise, sit near the front edge of a sturdy chair. Place your feet flat on the floor, about hip-width apart. Position your feet slightly behind your knees, rather than directly under them. This positioning helps engage the leg muscles more effectively. During the standing movement, keep your chest upright and your back straight. Place your hands either crossed over your chest or resting lightly on your thighs. If extra support is needed, lean your torso slightly forward and push through your heels. As you stand up, take about 2 seconds to reach a fully standing position. Once you are upright, pause briefly and make sure your body feels stable and balanced. Then slowly lower yourself back down toward the chair, over 3 to 4 seconds. The goal is not to drop into the chair, but to control the entire descent until you gently touch the seat. Begin with 6 to 8 repetitions. Gradually work up to 12 or even 15 as your strength improves. If the movement feels too difficult, you can start by using your hands on the chair or on the armrests for assistance. If it becomes too easy, try slowing the lowering phase to 5 seconds or hold the standing position for a few seconds before sitting back down. Beyond building leg strength, sit-to-stand exercises also train balance and coordination, because your body must shift weight forward and then stabilize while rising. This transition is exactly where many falls occur. Practicing this movement regularly helps the nervous system become more efficient at coordinating the muscles involved in standing and stabilizing. Over time, this can make everyday movements feel smoother, safer, and more controlled. The key to maintaining strength and balance after 60 isn't doing extreme workouts. It's continuing to practice the basic movements your body relies on every day. Just a few minutes of these exercises, done consistently, can help keep your legs strong, your balance steady, and your confidence in movement high. Start slowly, use support when needed, and focus on regular practice rather than perfection. If you found this helpful, let us know your age in the comments and which exercise you're planning to start with. And for more practical tips on staying strong, mobile, and independent as you age, be sure to subscribe.